Resuming debate, reprise de débat, the honourable member for Calgary Confederation.
I am honoured to rise and speak in support of Bill C-223, an act to establish a Canadian organ donor registry and to coordinate and promote organ donation in Canada. First, I would like to thank my colleague from Edmonton Manning for bringing forward this private member's bill and recognizing the importance of organ donation. I listened intently to the member's speech in second reading back in April, and I have to say it was a very passionate, moving speech, honourable member, and what you did for your son Tyler was incredible, and you as a living donor I consider a hero.
I just want to remind the member that he's to address his comments to the chair and not to individual members in the House. Thank you.
I'm really pleased that Tyler is doing well today. And to the member from Kitchener-Conestoga, thank you for sharing your emotional experience through the Speaker.
Once again, please address the comments to the chair.
The Speaker, to the honourable member, thanks and praise for his sharing his emotional experience from a tragedy occurring back in May 2nd, 2011, when the individual, the member, lost his wife Betty. For the member to support Betty's wishes and to allow her organs to be donated after her neurological death shows the selflessness and incredible gift Betty so indicated that she wanted to give to save the lives of others. Madam Speaker, 3 years ago I had the privilege to also bring forward a private member's bill on organ donation as a member of the Alberta Legislature. The intention of the bill was to create a provincial organ and tissue donation agency. The bill progressed and it was adopted into a government bill, and it was eventually passed unanimously by all members of the House. The bill incorporated four key pillars, four components to its content. The first was to implement an awareness campaign strategy, a strategy to have advertising, billboards, literature, bus benches, encouraging families, encouraging people to talk to their families, to talk to them, to discuss their wishes in the event of a tragedy where they may have to have a choice, their families have a choice whether or not to donate their organs or not. The second pillar was to implement an electronic donor registry. The third was to training of healthcare staff throughout the province of Alberta. Every hospital would have trained staff ready on a moment's notice to take advantage of an opportunity that may exist to procure in order to save lives. And the final was to implement the intent to donate expressed on a driver's license. Currently, Madam Speaker, not currently, but at the time, in order to indicate you want to express your wishes to donate, you would sign the back of your healthcare card. I found that unacceptable in today's world. The key to making a registry successful is to make the decision, make it easy to make and easy to execute. I strongly support the idea of getting one's consent to donate organs when someone obtains or renews a driver's license or a healthcare card. However, we could even go further, Madam Speaker, and ask it as part of a passport process or other formal registration processes. Imagine if we could get the option to declare that you are a willing organ donor on your income tax return forms. Today, Madam Speaker, Alberta currently has over 250,000 people registered in its newly implemented organ donation electronic registry, and the numbers continue to grow. And just recently, Madam Speaker, a team of experts at the University of Alberta Hospital at the Mazankowski Heart Institute made history by completing a record 31 organ transplants in just 10 days, indicating the progress that we have made in Alberta. But there is a lot more work that needs to be done. I have visited the U of A hospital transplant ward, and I have seen the results. I've met numerous people that have gone through and received the gift of life. What a moving experience it was. The emotions, the tears, the gratitude that these people had, awakening knowing that they had received a gift. It is something that I will never forget, Madam Speaker. So I have seen the need for a coordinated organ donation strategy firsthand. But I've also seen the results of a unified government that puts aside political stripes to support a positive cause. Madam Speaker, this is not about partisan politics, it's about saving lives. I can only imagine the positive outcome of what a coordinated national effort can accomplish. Madam Speaker, I currently, along with other members in this House, sit on the Standing Committee on Health. Our team is currently studying the issue of national pharmacare. This initiative is not about overstepping the boundaries of our provincial and territorial counterparts. It's about leveraging our strength as a country to improve the system of pharmacare for all Canadians. Why can we not do the same thing with our organ and tissue donation procurement system here in Canada? Our Standing Committee on Health have already agreed to look into the issue of organ and tissue donation here in Canada. So it is only appropriate that we send this bill, Bill C-223, that we are currently debating here in this House, that we send it to committee to form part of the study and discussion. Madam Speaker, it's not just our constituents and some politicians asking for this, but it's also experts in the field of transplantation right here in Canada. Experts such as Dr. Laurie West, who is the director of the Canadian National Transplant Research Program. This is a national research network funded by the Government of Canada, dedicated entirely to increasing access of Canadians to transplantation and improving transplant outcomes. She is also the director of the Alberta Transplant Institute and chair of Canada Research in Cardiac Transplantation. Now, Dr. West, she wrote all of us in this House here. Just last week, she wrote us all, and she said, and I quote, "We believe that we have the opportunity to use this bill, Bill 223, as the beginning of a national conversation toward improving organ donation in Canada. We strongly encourage your government to send this bill to the Standing Committee on Health, where we can work together with patients, researchers, health charities, and government agencies to create a framework that will improve the national system to increase and support donation and transplantation." Madam Speaker, just in April of this year also, the Honourable Parliamentary Secretary to the Minister of Health, she said right here in this House, and I quote, "Our government recognizes the need for improvement in organ and tissue donation and transplantation system here in Canada. Collaboration, consultation, and engagement with the provinces and territories, as well as key stakeholders, are necessary to address the complexity of the changes that are required in the system." She says it is necessary to collaborate, consult, and engage with the provinces and territories and key stakeholders. Madam Speaker, so then why don't we send this bill to the Committee on Health? Please, Honourable Member, Parliamentary Secretary, talk to your caucus, talk to your colleagues, talk to the Health Minister, and encourage support for this bill to go to committee so it can form a critical part of that deliberation. In closing, Madam Speaker, rather than continuing to work in silos, our provinces and territories must work together under a national umbrella in order to improve organ donation in this country. We know registries work for organ and tissue donation. We also know that the larger the pool of donors, the better. It only makes sense that we combine our efforts and truly develop a national database that will help achieve our goal to save lives. Madam Speaker, even if we are able to save one life from our efforts, it will have been worth it. I implore my colleagues here in this House to vote to send this bill, Bill 223, to the Standing Committee on Health, where the committee has already agreed to study this issue. Thank you, Madam Speaker.
Questions and comments? Resuming debate. Reprise de débat. It's early on Monday. The honourable member for Calgary-Shepherd.
Thank you, Madam Speaker. I would have done questions and answers as well after that very eloquent contribution by the member for Calgary Confederation. I want to thank the member too, through you, Madam, because thanks to his contributions at the provincial legislature in Alberta, the province, has an electronic organ and tissue donor registry, of which I'm actually a donor. I've actually subscribed myself thanks to that new system that he introduced. He's also one of the very few members of the Legislative Assembly when he served there to have actually passed 2 private members' bills in that legislature. So I hope that fortune and that ability passes on to the member from Edmonton Manning, who is pushing what I think for a very wise bill on organ and tissue donor registries. And like I've done before, I have